Hello, I'm Dr Louise Newson. I'm a GP and menopause specialist, and I'm also the founder of the Newson Health Menopause and Wellbeing Centre here in Stratford-upon-Avon. I'm also the founder of the free Balance app. Each week on my podcast, join me and my special guests where we discuss all things perimenopause and menopause. We talk about the latest research, bust myths on menopause symptoms and treatments, and often share moving and always inspirational personal stories. This podcast is brought to you by the Newson Health Group, which has clinics across the UK dedicated to providing individualised perimenopause and menopause care for all women. So I've been looking forward to this podcast for quite a long time, and now it's happening. So I've got with me Dr Rob Galloway, who is an A&E consultant, ex-stand-up comedian, someone who's transformed his life and really thinking about medicine in a different way to maybe when he qualified. And I certainly think about medicine. I think about my training. I think about so many things I didn't do right as a junior doctor that I didn't think about because I didn't know. And I've spoken about some of this on my podcast before. But I'm 54 and I'm really committed to improving health of as many people as possible in as many different ways as possible. And this podcast is one of those ways. So I'm very excited, Rob, to introduce you to my guests today.
Thank you very much for having me, inviting me.
So can you just give a very potted history, like who you are and what you do and what you're doing now?
So I'm Professor Rob Galloway. I'm an A&E consultant down in Brighton and I work at Brighton Sussex Medical School. I've been a doctor since 2001. Essentially, it's my third choice career. I did a couple of awful stints as a stand-up comedian and failed completely. So I also wanted to be a footballer, but I was rubbish. So basically, the two things I wanted to do, I couldn't do. So I went into medicine. But I got attracted to A&E because for a number of reasons. One, I like the excitement. Anyone who knows me knows I've probably got undiagnosed ADHD, which I probably think is a superpower rather than an illness. And I get bored incredibly easily. But also I had some altruistic view that I wanted to help the most vulnerable in society. And it is the most vulnerable in society, post A&E. And so I trained as an A&E consultant, also trained as an intensive care consultant, and spent 13 years as a consultant, working full-time for the last 24 years. And it's made me reflect. The last few years has made me reflect. So at the beginning of my career, I was quite academic. I'd written a couple of textbooks on critical appraisal and how to assess the evidence for certain things. I'd also had a little foray into other things. So I'd written a book about what it was like working in A&E called In Stitches, the highs and lows of life as an A&E doctor. And I wrote that under pseudonym Dr Nick Edwards because I didn't want to get sacked at the time. And I also work as the medical advisor for Brighton Football Club. And I'm very interested in patient safety. So I have an article every couple of weeks with the Daily Mail, and I run patient safety courses. So I've always had this eclectic career. But over the years, I've concentrated on two things: the clinical work, patient safety, and also workforce. So I've set up different systems for workforce for the junior doctors. But all of it was to create staff and create systems that we could look after patients when they became unwell. So if someone fell over, I could know how to block their broken hip. If they're the pain, refer them to orthopaedic doctors. If they were having a diabetic crisis, how to treat that. And I, in all honesty, during my late 20s and 30s, I worked incredibly hard to get lots and lots and lots of qualifications. I've got lots of letters after my name, probably to the detriment of my well-being, in all honesty. And so I've got a lot more letters than friends. And I was probably at the not top of the game. That's please don't think arrogant, but I knew how to look after very unwell people. And I worked at a trauma centre, and I was providing good care. But the last few years, I've gone through a transition in my life. I went through a difficult time. 7 years ago, my dad died. I went through a divorce. I was quite down. I was on antidepressants. I was overweight. I was unhealthy. And it was going through that time that I also realised that actually what good was I doing at work? Because however much effort we put in to keep the NHS going, the more and more, because I was managing the workforce, the more and more staff I put into the systems, the more and more health or more and more medicines we prescribed, the health wasn't getting any better. The weights were getting worse. And I work in A&E, I can see the current westernised system has utterly failed.
Yeah.
I'm about to do a late shift tomorrow and then a set of night shifts. The last time I was at work, there's 36 people in a corridor. This is not 36 people just waiting to be seen. This is those 6 people in a corridor for hours and hours and hours who've been seen by doctors and have had treatment started, but they're waiting to go to bed. The demands are just way greater than what we can afford in society. And if you look for the first time in society, life expectancy is going down. But it's not just life expectancy, it's health span is getting worse. And it made me realise that actually everything I've been doing has possibly been wrong, and I've possibly wasted the last 24 years. And it made me reflect, and that's the journey I've been going on.
And it's so interesting because we're very reactive in medicine. And I think when I was doing A&E many, many years ago, I enjoyed it, but not like you, I don't like the uncontrolled nature of someone coming in really sick, and I like to be really calm and in control. So I found that quite difficult. But being a medic means that you are exposed to all sorts of people from all sorts of life, which I think is such a privilege. And I still do now. I love working in areas of deprivation. I've been doing a lot of work in prisons recently, and I just love it. I think there's so much we can give back. But medicine, as I used to know, it was very reactive. It's like playing ping pong. You're just firing, and you're treating the condition. And then more and more over the years, partly because I've got older, but my knowledge has really improved about inflammatory diseases, how we reduce inflammation in the body. And I know you're really interested in it too. I didn't know that clinical depression, osteoporosis are inflammatory diseases. And I also didn't know that we are less healthy as we age. And this whole lifespan age, the lifespan versus health span is so different, especially actually for women. Most of us as women spend the last 10 years of our life in ill health. And even as a doctor, as a GP, I used to visit nursing homes, care homes, sheltered accommodation every single time I visited. And it was 90% of the times women. Did I ever once think about their hormones? Never. I would love to go back in time, Rob, because all those UTIs, urinary tract infections, didn't even think about giving them even just a bit of local hormone that we know there's evidence reduces urinary tract infections. But then, people with total body pain, people with confusion, people with palpitations, didn't even think about hormones. But we're not trained to do that, are we?
No, I think we've got a medical model which is very much pharmaceutical led. There is a treatment, there is a drug you can prescribe, and this is the protocols we're given. So similar to you, or opposite to you, I love the chaos, the not knowing what's going on. I couldn't do your job because I just can't stand just doing, single issue manage. Do you know what I mean? I like the chaos of someone who's had a heart attack, then someone coming with a trauma, then someone's down trying to stab me. That type of thing gets me excited at work. But the thing which, that after a while you think, are we doing the right thing by always treating patients? Are we doing the right thing by saying, right, this is what you need? But actually, should we stand back and be more of what I call a risketician? Are we actually doing the right thing for the patient by organising another CT scan? Or should we step back and say, are we doing too much medicine?
Yes.
Are we giving another antidepressant, antihypertensive, anti-cholesterol drug? Is there other things we should be doing? But crucially, what I've realised from all my experience is actually so much of what I see is preventable. And the amount of money we're pumping into hospitals, it's in the wrong place. If there's one thing I could prescribe and to everybody, in that it will be exercise, because exercise is antidepressant. It's the evidence for exercise is, I would say, better than for sertraline for mild depression, not for severe depression, but for mild depression, like I had. So I was put on sertraline because I think I had a response to misery rather than a normal response to misery, rather than severe depression. But so exercise is such a good thing. But what's ridiculous, I went to the GP asking for sertraline rather than...
Well, you didn't know.
Because I was so fixed in that medical model. But things like exercise, so good for depression, for reduction of cancer, for reduction of diabetes, for Alzheimer's. We forget how important that is. Then there's diet. And I've lost about 10 kilos by just looking at what I eat. I used to eat just dreadful food. I used to think nothing of having a Mars bar, packet of crisps during my lunch break. At work, the hospitals are such an unhealthy environment. You cannot eat healthy food because the most of the vending machines just sell variations of awful ultra-processed food. Health, the way you manage health has to be done from the very beginning. Every department in the country, every politician needs to look at their different areas and how we can promote health. I took my kids to the leisure centre the other day to go swimming. I tried to get them some food. The only food at a leisure centre was awful ultra-processed food. And this is the bastions of health, leisure centres. And I couldn't feed them healthily. So we've got to have, we've got to do everything to promote good health and prevention, because we are facing this rise in cost of ill health. Society can't afford it. We've got one life. We need to not waste it by getting ill. And that's why people need to invest in their own health. Rather than just accepting illness, we need to invest in our own health. And do you really need to go to another work meeting? Do you really need to send that other email? Or would you be better off at 6 o'clock in the morning going for a run? And that's something I've started to tell myself.
I think you're absolutely right. And I've certainly become more selfish as I've got older. I carve time in my week to do yoga. I make my own lunch because otherwise I can't get it at when I'm here because I'm too busy, and then I could eat something. But I'm lucky and not lucky that I get quite bad migraines. So if I don't eat healthily, it will trigger a migraine. So I've always got that to tell me. But a lot of people haven't. They can just eat what they like, when they like, but it catches up. But also part of our training is not looking holistically. It's looking at which drug for which treatment. And I know obviously all I do is hormones, but they affect every single organ in the body. So today I've seen a patient who's been given antidepressants by the psychiatrist. She's been given blood pressure treatment and treatment for her fast heartbeat from the cardiologist. She's been given painkillers because she's been diagnosed with fibromyalgia. They're talking about statins because her cholesterol's up. But she's also 48 and her periods have nearly stopped. And she's perimenopausal. So in medicine, we did get taught, I know I did, treat the underlying cause, but no one is looking at the common denominator. And medicine's become more siloed, hasn't it, with time?
And it's also become as well as the hormones, what else is underlying for all those things? Is it obesity? I don't know your patient, obviously, but is there the diet? There is obesity, as well as the hormones. Is there something that
it's definitely together? Absolutely. And often when people's hormones are balanced, they're like, do you know what, Dr. Newson, I'm getting up in the morning, I'm going for a run, I'm going for a little, I'm going outside, because most of us are inside the whole time. I'm going outside, I'm talking to my friends, I'm having a cup of herbal tea rather than some, I don't know, fizzy drink. And it's those little things, isn't it?
Also, society's become too medicalised. Everyone's scared of going outside in the sun. You get skin cancer. But actually, sunlight is so good in preventing depression and preventing inflammation. All these things we need to think about that we've just become forgotten. And when I look back at, the medical model I was taught until about 5 years ago, I would teach, in all honesty, was based on drugs and operations are the solution. I can't remember any nutrition training I had. Nutrition training I had was incorrect because it talked about the dangers of fats rather than the dangers of ultra-processed food and too many carbs and sugars and crisps and that sort of thing. But I remember as a junior doctor, a medical student, we were taken out constantly by drug reps. So I would get my good meals by going to restaurants with a drug rep. And so that subliminal, I'd have and then I'd sit there for 10 minutes and think, I'm not going to listen to them. But actually, that subliminal message. And
no, you do, because I'm a bit older than you. And I remember when omeprazole came out, which is a PPI, proton pump inhibitor, and it was game changing. And we went to Granada Studios because I was in Manchester, and I've never been before because we were students actually, and doing any trips was a big thing. And we didn't really go to those sorts of trips. So we went to Granada Studios, a whole tour. We felt really privileged because we weren't even doctors, we were medical students. And I remember having such a great time, but it was still drip fed. Acid is bad. Can't have acid in your stomach. This is really good. And we were like, wait till we start prescribing. These sound really interesting. And now we're trying to get people off some of these drugs. Don't get me wrong, they have a role, but they're not something we should be just giving to everybody.
And they have there are risks for them. And what we don't teach in medicine is to think about number needs to treat. How many patients, the ones in front of us, like with the same condition, do I need to treat to save one life? And then what are the harms of that? So you've got people who've got a slightly higher raised cholesterol. you may need to treat hundreds of people like that person in front of you with statins to save one stroke or one heart attack, and over 10 years, but the side effects of those medications are massive. And then when we think about, we also are far too quick to organise diagnostic tests sometimes. So we don't think about number need to investigate. How many patients in front of me with this condition do I need to investigate to save a life? So a really good example is we've got any person from a nursing home who comes in with a fall, and it's standard protocol that they'll, if they bang their head, they've got some bruise, got some confusion, we'll get a CT head, which is fine. But actually, how many CT heads do you need to save life? Because most of these patients wouldn't go for an operation anyway. We are treating our own anxieties and our own risk of being sued. And that is one of the problems. We've got defensive medicine rather than being risketicians. We've become too protocolized, and we've not thought about the bigger picture and thought about the person. We think about illness, not people.
Yeah, I think that's so true. And so many times I'll say to patients, I will only do a blood test or a scan if it's going to change my management. You are more than just a number. And sometimes it can be quite hard for them to understand that. But once they realise that, obviously then if they don't get better, we will consider if they need a scan or a test or a referral or something else. But it is also this multi-pronged approach that I think so much in medicine we think, we'll give a treatment and then see if it works. But actually, we'll give a treatment, but also we'll talk to you about your lifestyle. And actually, I did an Instagram Live the other day just about exercise. And I'm not an exercise specialist. I am honestly not incredibly fit, but I do yoga regularly for my mental health, my physical health as well. And I was just talking generally about moving, not always exercise, just doing something. And somebody then messaged me the next day and say, Dr. Newson, because I listened to your chat, I got up at 6 and went for a walk. Thank you so much. And I'm like, yes, come on, that's brilliant, isn't it?
Well, I don't think you don't need exercise specialists to necessarily help you about exercise. Just need to do something you enjoy.
Yeah.
If you enjoy playing tennis, play tennis. If you enjoy going for a run, go for a run. Just make sure you get out and exercise. The other thing is people forget is how important weights are. And it's not just aerobic running and cycling. It's actually physical, lifting weights. And that's, if you want to lose weight, it's about diet and it's about improving your muscle. You won't be able to run yourself into a diet. It's about building up the muscle because that increases your metabolic rate and that makes it easier to lose weight. Plus it's the diet. And so it's the weights as well as the aerobic exercise, which is so important.
And one of the things I really worry about is frailty. I've spoken about it before, this osteosarcopenia, so loss of bone mass, muscle mass, and just general frailty, more likely to trip over the carpet, more likely to have a break. You know more than I, but all these factors that especially elderly women are coming into hospital with.
The number of ladies I see who postmenopausal, their bones are brittle and they fall over, they break their hips. It is such an awful condition because it's a sign. It's not necessarily the hip breaking which is the problem. It's the sign of how unwell they are. And there are things you can do to prevent it. Now, I am on vitamin D and K2, which is a tablet I take every single day just to improve my bone density. And because I've got into this, I got a DEXA scan to look at my bone mass and my mass, and I'm in the top 95% of the population of my age group.
Right.
The bone mass, brilliant. And it's not that that's too high. Probably 50% is too low because that's what the average person is. But I don't want to break my hip when I'm older because I know what a death sentence that means. And so it's about making sure your vitamin D levels are high enough. I don't know any harms. If you take the standard amount, virtually no harms. Obviously, if you overdose and take too much, there is vitamin D toxicity. But if you just take the standard amount in the vitamins, not to cause any harms, then exercise, that makes a massive difference. And then where you're the expert in terms of the hormones, that's not my area at all. But I do know that it is such a danger that someone breaks the hip. Yeah. Tragedy.
But we've known actually since 1941, Professor Albright first noticed that hormones are very good at building bone. And so one of the first indications for HRT actually was for osteoporosis, both treatment and prevention. But then since the bisphosphonates and other drugs have come on, they've obviously a lot more expensive, lots of drug companies make them. And so that's been pushed out. And they, of course, have a role, but actually, again, treat the underlying cause. If they're postmenopausal, the low estrogen has contributed to their thinning of the bone, then give back the estrogen to help build the bone. But we found out last year with a number of fractures, fragility fractures in women, only 0.15% of those women were prescribed HRT. That is nothing, is it, Rob?
Yeah. And even before we become perimenopausal, you can do all the other things like with the vitamin D way before you get there to do everything you can. And that's just, bone fracture is just an example of all the things we can start doing to try and to improve our health span, because ultimately that's the only way the health service should go, is in trying to improve health span. And, so... We've got to have that mind flip. We've got to have that mind flip. Otherwise, the health service won't be there for us when we really need it for some awful accident or illness that isn't preventable. We need to get rid of as much preventable unwellness as possible. So a really good example is type 2 diabetes. It's such a killer. It causes strokes, heart attacks, cataracts, blindness, everything. But actually, instead of just treating it with more and more medications, you can diet your way out of type 2 diabetes, not type 1, not when you need the insulin injections if you're young, but an obesity-related type 2 diabetes. Basically, go on a virtually no-carb diet. Really, it's not harmful at all. Do it with a dietitian. You completely change your body's relationship with insulin, and you stop becoming diabetic. And you can add years and years and years of quality life to yourself by just lifestyle changes. And then you combine those lifestyle changes with the treatments you need, and people's health can be utterly transformed.
And it's interesting. So before I left general practice, I had a few patients who finally started listening, because it's hard to make changes. It really is, to lifestyle when you've had certain food choices ingrained in you. But they did start, and I had a few men actually who were transformed, but it meant they came off their antihypertensive, they came off their statins, they reduced their type 2 diabetes medication, they stopped their antidepressants, and they felt so well as well. But that's not great for Big Pharma though, is it, Rob? There is this sort of thing about the money. The turnover for some of these drug companies is actually in billions, not millions, isn't it?
It is not good for profits if people stop being diabetic, because they'll need a lot less of all those medications. And actually, we should be investing our money in longevity clinics, in well-being clinics. I had a meeting today with this place called the Wellbeing Pharmacy in Hove. It's a private pharmacy where they're starting to do a lot of well-being checks, longevity clinics, exercise performance tests, and they've got a great setup to look at how to improve your longevity, improve your health span. And actually, if some of that investment was moved that way rather than to treatment, the impact could have been massive. And I can signpost, if anybody wants to email me, it's drrobgalloway@gmail.com, and I can signpost you to the pharmacy who do this type of things. But there's just so much good which can come from it.
Yeah, absolutely. No one's ever too young to start making changes. But the other side is no one's too old. I think there are quite a few people who think, well, I've always been like this, it's really difficult. And certainly I've had some great responses to people in their 70s or 80s who've made very simple changes to their lifestyle, usually by a combination of changing their diet, maybe not having as many biscuits with a cup of tea in the afternoon, but also just walking up the stairs rather than using the lift, or walking to the bus stop or the next bus stop rather than the first one nearest to their house. And those little things really can be transformational to future health, can't they, Rob?
I completely agree. So I'm involved in a company called Healthy for Longer. It's about trying to move physical exercise into carers, and when carers go to patients' homes and also into nursing homes, residential homes. So instead of just making the patient a cup of tea, get them to actually do 15 minutes of exercise. And so this small startup company called Healthy for Longer, the impact they could have on patients is unbelievable. It genuinely is unbelievable, because we've made a series of exercise videos, and the carers are trained into becoming personal trainers there's all evidence-based things, and I've advised what exercise to do, and they get these patients who are normally sedentary, don't move, are getting weaker and weaker to start lifting weights, start doing simple exercises, and then actually the number of falls goes down, the number of the mental well-being goes up, and it's that type of attitude. That's where the money needs to be in. That's where the investment needs to be in. That's where you do that. Then for a year, you won't necessarily need to send them from their home into a nursing home. You won't need that dependent care. We create that different attitude. It can make such a big difference.
So how are we going to do this? Is anyone at the forefront of this?
The problem is it's not sexy. What I used to do, or what I used to be interested in, I still am. I'm an A&E consultant. A lot of my colleagues work in the helicopter emergency service. They jump out of helicopters, not jump, and save people's lives who've had a big car accident. That's quite sexy. Doing a angiogram when someone's having a heart attack is quite sexy. Doing CPR, but actually, what we're talking about, not being rude, is pretty dull. You're not gonna have 24 hours in Louise's clinic as a TV program. You're not gonna have 24 hours in longevity. You're not gonna have the new casualty to be based on someone going through, right, this is your risk factors. Why don't you take that? Why don't you take this? Why don't you stop smoking? Why don't you drink less? Why don't you lose weight? Why don't you go and speak to Louise about hormones? Because that's quite dull. But what we need to do is make it interesting, get people excited about it, because, I'm an older father. I'm 47. I've got 5 kids. My youngest one is 3 months. I want to live. I want her to. Yeah, I can't cope. I'm struggling, to be honest. I am utterly exhausted. But I don't want my baby daughter to have a 65-year-old dad who then dies from stress and a heart attack. I want to live to 100. I want to live to 100 when I'm active and well, and it's biologically possible. We've got a modern society which has got antibiotics and has got clean water, and that's what used to kill people. And now we've got, there used to be wars, trauma, and infections used to kill people. We've got over that. Now what kills people is dementia, is diabetes, cardiovascular, and cancer. But a lot of that is preventable by lifestyle things. And so actually, by thinking, I want to live longer to be able to still provide for my family, still work, be interested, do things which excite me, because I find life exciting. I want to live longer, healthier. That to me is exciting, is as exciting as what I used to think was exciting. And so that's how we do it. We get people excited. We get a movement of people interested in that holistic way, rather than thinking you're quacks who are mad, to show the evidence behind it. And you can only do evidence-based medicine. Everything we have to do has to be evidence-based. And a lot of people always talk about, you can only do something if there's a randomized control study showing it. I always practice best available evidence-based medicine. Now, there's a difference between evidence-based medicine and best available evidence-based medicine. So there is no randomized control studies which show smoking is dangerous. It's observational studies. We know from observational studies that it's dangerous. The people who fund the best, what you call the gold standard randomized control studies, are often pharmacy companies or pharmaceuticals. But actually, if double-blind placebo-controlled trials and things like acupuncture, there has been some which now show that it can work. We can see these differences of more holistic ways of working can make a difference. It's going to be hard to show a randomized control study in the dangers of ultra-processed food, because I would not want to be in the control group who get ultra-processed food. But so observational studies will have to show the dangers. But we need to make this patient-centric view sexy, rather than that individual treatments and the exciting things sexy, because then we can really make that transformation of what our NHS needs and what we as individuals need.
I totally agree. And some of it doesn't need huge evidence, because a lot of it is common sense as well.
Yep.
And I think we're forgetting common sense. I grew up in the 70s and we had street parties for the Jubilee in 1977. And I was looking at some photos recently and there was no one overweight. Everyone was lean, but our food was very different. Everything we did was very different. So we have to just go back to basics as well and think about what we're eating, what we're drinking, how we're moving, and that will make a huge difference. So there's a lot we're going to do. Even if we do all this, Rob, you will still have a job. People will still have accidents. People will still have heart attacks and strokes.
Absolutely. And I want to be there for unpreventable things,
Yes.
because at the moment we are utterly overwhelmed, and I can't, I'm providing treatment, not care, because care is treatment with dignity.
Yeah.
I no longer provide dignified care, because I don't have, because the NHS, in all honesty, is failing. The medical model that we've grown up with, that I've taught, that it's been part of my psyche, has failed. And it's only the last few years, when I've gone through my own transition of I was unwell with Crohn's and depression. My Crohn's is so much better now. I've changed my diet. I know I still get anxious, but my depression in many ways has been cured. Not depression. My upset about things was cured by a 5K run every day. I've gone through my own journey in how I've transformed my health, and I think you're seeing me because I probably don't. I'm stressed because I've got 5 kids and I do nights still, and I don't. But I'm still maintaining a vaguely healthy balance because I've re-looked at myself. But I want to look at the whole population of the people I treat, and the current model has failed, is failing, and we can't just tweak the status quo. We are in an absolute health crisis, and what we mustn't do is waste a good crisis. We've got to use this crisis to transform the health of our population, and it's a once in a generation opportunity at the moment.
So right, and such a wonderful way to end. But before we end, I always ask for 3 take-home tips, and these are going to be quite easy, actually. But 3 things that we can all do, because I know however healthy we are, we can always do better. So 3 things that we can all do that will help keep us healthier for longer, Rob.
I think number 1 is think about what you want to be like in 20 years' time, 30 years' time with your grandchildren. Do you want to lift up your kids and fly them around? Do you want to be able to lift up a suitcase and go on holiday with them? If the answer is yes, then you need to invest in your health. Like you invest in shares, you need to invest in your health. Can you run 100 metres with your kids? Can you pick up their suitcase and take them on holiday? Can you lift them over your shoulder and fly them in the air? Are you going to be there for your grandchildren's 18th birthday? Once you realise what your answer is, then everybody knows the answers. Because I could say, number 1, stop smoking. Number 2, do some exercise. Number 3, eat healthy. You know that. So that'd be my number 1 tip. Think about where you want to be. Number 2, make things easy to live healthily. So I have a chocolate addiction. I am utterly obsessed. I love chocolate. And the first thing is I just try never to buy it now in the house. But the third thing is I say to my kids, if you ever see me eating chocolate, I can guarantee you I will give you £15. I don't like losing money, and I have a fine system. So if they catch me eating chocolate or crisps or awful fizzy drinks, don't eat that. I'll pay that fine. So create an environment where it is easy to live healthy. So make habits. So get up in the morning, first thing to do, have some water, go for a run before you do anything, or get up, just make it into a habit, because if you're outside of a habit, you won't do it. So number 1, have an aim. Number 2, have a habit. And just trying to think of number 3. You didn't give me any warning for this, so I haven't really thought of the third one. Come back to me. Do something like I'll think of a third thing.
I think number 3 is empower yourself with information, actually, and make choices that are right for you.
Yeah, I think the days of saying you can't do it, you can, because even though things aren't hard, it is very hard. Ultra processed food is cheaper. It is probably sometimes cheaper to drive than to buy a new bicycle and cycle, but there are things we can do. And so we need to realise where we want to go. We need to make those habits easy, and we need to believe that we can make a difference, because actually we can.
Perfect. Very good. So thank you so much for your time. I know you're going off to do more work, but I really appreciate you cramming in this space so we can educate and make people think differently about their health and disease prevention as well. So thanks so much for your time today.
Pleasure. Thanks for having me.
You can find out more about Newson Health Group by visiting www.newsonhealth.co.uk. And you can download the free Balance app on the App Store or Google Play.